Hi everyone, welcome to Module 5 of class. So last week we learned some word parts and key terms that involve the lymphatic and immune, cardiovascular, and the respiratory systems. We also had a very good discussion regarding your patient scenarios that you created, so I just wanted to say kudos to you, nice job on these. All right, so this week we are covering 3 chapters: the urinary system, the female reproductive system, and the male reproductive system. So by the end of the week, you will not only be able to recognize the terms and abbreviations that go along with these chapters, but you will also be able to properly spell and pronounce them as well. All right, so when working with patients, I often discussed fertility issues, irregular menstrual cycles, and pathological conditions which affected the female reproductive cycle, such as polycystic ovarian syndrome. So there are a lot of signs and symptoms that go along with these conditions, so it's really imperative that we know and understand the related medical terms. So in the live classroom session this week, important combining forms and key information will be covered regarding these chapters. So make sure you attend or review that recording and submit the passcode for credit. All right, so do you know why it's important to have strong medical terminology skills, especially when working in the medical field? How do you think lacking this knowledge could affect your daily job and interaction with patients? When I work directly with patients, they often ask questions for clarification. So when you are working with patients, they may ask you about what the doctor said, or even ask you to explain what a medical term or condition really means. Will you be able to do it? It could be embarrassing if you don't have a clue about what the medical condition is or even what it pertains to. So let's say you are working as a medical coder and you are reviewing a patient's file to make sure the doctor has assigned the correct diagnosis and procedure codes. Will you be able to catch a mistake if the doctor accidentally makes a mistake in the record? What might happen if you miss a mistake? There can be some dire consequences when errors are made in medical records. It can affect the patients. It can affect the way the doctors treat the patients. It can affect the way medical coders actually review the records and then send them out to insurance companies to, for reimbursement, right? So there's all different scenarios with that. And so these are just a few things to think about when considering the importance of medical terminology knowledge. So for our final class discussion this week, and you may have noticed I said final class discussion because there is no discussion in Module 6. So you want to make sure you follow the directions very carefully. For your initial post, you're going to provide one example of a valid and reliable resource that you would be able to use in your future career. You want to make sure to cite your reference properly using APA formatting and then describe why you believe it is a valid and reliable source of information. For your reply post, you're going to access the resource that your classmate identified, and you're going to find 3 terms that are unfamiliar to you. You're going to list and define those medical terms in your post, and then you're also going to discuss whether you agree or not as to whether this reference is a valid and reliable source of information, and then of course why or why not. So your assignments for this week, you have your Module 5 quiz, the course project, the dictation assignment, and the live classroom attendance. So remember, if you have any questions, be sure to contact me in the messages area in class. Thanks.